Dr. Sanjay K Banerjee is an associate professor in the Biotechnology Division of the National Institute of the Pharmaceutical Education and Research, Guwahati, India. His current research, Dr. Banerjee's research focuses to identify the novel targets and understand the molecular mechanism of the chronic and complex diseases like cardiac hypertrophy, heart failure, diabetes, and non-alcoholic fatty liver disease. His work revealed several novel cellular signaling pathways that perturbated during the disease progression. Over to Dr. Sanjay, please.
Okay, thank you very much for the introduction. Can you hear me?
Yes, sir. Please.
Hello?
Yes, sir. Please
Okay.
continue.
You're audible. But can you make it full screen?
Yeah, I'll do it full screen. Thank you. Okay. So first, I'd like to thanks to the organizer, especially Professor Ganguly and Dr. Nirja for inviting me and giving the talk. I want to be physically to be there, and due to my one small fracture in my leg, I'm not able to make it. But I hope I can like present online whatever I want to present physically there. So the title of my talk is Probiotics from Traditional Fermented Food from Northeast India, Impact on Cardiometabolic Disorder. So my laboratory last 15 years working on cardiovascular diseases along with diabetes and NAFLD. So whenever we look the diseases in human as well as making animal model, we realize that this not come as a single entity. Whenever try to make diabetes, the same the patient or the animals we got, they have also having a cardiovascular complication as well as they got fatty liver. So we realized that disease is come together most of the times, and it is a basically syndrome. So that's why my work basically now shifted to mostly on cardiometabolic disorder or cardiometabolic syndrome. And I'll talk a little bit about the probiotic work what I'm doing actually last I can say only 8 months. I am not in very new in this particular field. So as I talk about cardiometabolic syndrome, basically includes a cluster of conditions which include abdominal obesity, insulin resistance, and dyslipidemia and blood pressure. So when these diseases come, cardiometabolic diseases, it is not a single organ disease. It affects the heart definitely, as well as pancreas, liver, kidney. So those are together. Sometimes it comes with two disease. Sometimes come with three organ defects together. So very difficult to control or treat these kind of patients. So if you look actually the the statistics of cardiovascular disease in the world. So they are the #1 killer in the world. But India also not exception in it. In US, there every 34 seconds, 1 person die in cardiovascular diseases. In India, burden also very much. If you look actually, the estimated annual death in India among all non-communicable disease, cardiovascular disease is the #1. 26% people die in cardiovascular disease. 1/3 of the senior citizens in India who are diagnosed with hypertension, 5.2% with a chronic heart disease, 2.7% with stroke. According to MCCD report 2008, they showed that cardiovascular disease accounted for more than 57%, actually more than 50% of the total death in the age group of 25 to 69 years. And India, the mean age of having the first microbial infarction is 53, which is almost 10 years earlier than the happen in developed countries. Similarly, if you look that state-wise, Kerala is the ahead. They having a more number of cardiovascular patients and the death, and then followed by Goa and Andaman Nicobar. But if you look actually which state in India is the lowest events like Chhattisgarh, the Meghalaya and Nagaland. So this is very important to to work on it and to find how to prevent cardiovascular disease or cardiometabolic diseases. So if you look actually the therapeutic option, generally if the disease is very early stage, we generally having a preventive strategy. And if you come to the stage where there is preventive strategy along with the drug intervention, they work together. So when you look actually preventive strategies, small weight loss, moderate physical activity, dietary restriction in calorie intake, change in dietary composition, and also recently last 10 years, we talk a lot about if you improve your gut dysbiosis. So your gut health is very important for any diseases, not only like, communicable diseases, but non-communicable diseases also play an important role if your gut is good. And regarding the drug intervention, most of the drugs used for atherogenic dyslipidemia, elevated blood pressure, insulin resistance, those are the drugs always used when you go to the clinic. And my interest is that how to improve the cardiovascular health by giving a preventive measure. If you think about preventive measure, nowadays people talk about that probiotics. So what kind of bacteria present in your gut, they may improve your overall health. So, but how to improve it? So if you think about what kind of probiotics are important, a lot of research is going on. I'll talk today something which basically, in the culture of Northeast India, there are 8 states is there, and they use a huge amount of fermented foods. More than 300 fermented foods are used in different tribes and this area, and it is a regularly they use. It's not like they use 1 and 2 days in a week. They do 2 to 3 times and regularly. So why gut and heart axis exist? Because we have seen a lot of literature that when you're having a healthy heart, you generally take a healthy diet. Your active lifestyle is very important, and you having a bacteria like Roseburia, Faecalibacterium, as well as your quantity of certain metabolites like TAMO, TMAs will be less, and also low LPS. But similarly, when you're having a poor diet or sedentary lifestyle, we have seen kind of presence of pathogenic bacteria like Klebsiella and Prevotella like this, and also having a high blood level of TAMO and TMA. LPS level also very high. So all this affect to the to the overall cardiovascular health, like you can get hypertension, endothelial dysfunction, developed of fibrosis, mostly in cardiac tissue. When they get fibrosis, they tend to go to the heart failure stage, and also you get a myocardial infarction or heart failure. So we know that there's a directly link to the gut dysbiosis as well as the cardiac health. So as I talk about Northeast India, as we having a very rich traditional culture, and they are still maintaining. If you look actually what are the most common food, fermented food use in Northeast, all 8 states are started from soybean, which is used a different part of the state with a different name. Then bamboo shoots, very important because this is very special part, and this Northeast they use a bamboo shoot. Then milk, fermented milk they use. Fermented fish, they use their fermented rice beer, legumes and cereals, and different vegetables also they do fermented and they use it. So this is a culture, and whoever comes here, they can see every local store, they sell this kind of fermented food. So my interest was that to explore one of the fermented food which already using here, and they having traditional knowledge, they having good health, especially cardiometabolic health. So the aim of a study to identify a probiotic strain from Northeast fermented bamboo shoots and validate the strain in animal model for efficacy in cardiometabolic diseases. Why I choose bamboo shoot? Because as I said, this is most of the states in the Northeast they use bamboo shoot. They having a different name, but the preparation also a little bit different. But good thing is that these bamboo shoots, they know that they provide a very high micronutrient. They boost immunity. And these bamboo shoots have the property to reduce body weight, reduce cholesterol, especially LDL cholesterol, and reduce blood glucose level. So, but there's not a lot of work has been done. There are some work is available, but people are not done in validation point of view, like any animal model as well as human studies. So if you look actually the here in the map of Northeast, and if you see that these bamboo shoots actually used in different states like Nagaland, Manipur, Mizoram, Tripura, Meghalaya, Sikkim, Arunachal Pradesh with a different name. So what we basically did beginning that we looked at which part of the the states they hugely use this bamboo shoot fermented food, and they also having a good literature. So we searched that mesu is one of the preparation of bamboo shoot that obtained from Sikkim. And there are different kind of tribes like Lepcha tribes, Gorkha tribes, Limbu tribes. They use these bamboo shoots for their good health. So we thought we should work on the mesu, and we then started our work in the laboratory. So if you look the how they prepare the mesu in general, so there are three different kind of bamboo species available in Northeast. One is Bambusa tulla, Dendrocalamus hamiltoni, and Dendrocalamus sikimensiasis. So there are three different species. So the preparation is very easy. Like they go for make the the bamboo shoots, and then defoliation of the bamboo shoot is the first step, and then you have to do cleaning, and then you have to cut a small pieces. Then you have to go for packing tightly into a glass jar, or mostly in a tribal people they put into the bamboo gum, and they keep for generally 7 to 15 days. But some places I have seen they keep for 30 days. So in that fermented bamboo shoots they use for different way in the food preparation. So so my job was to how to make the same fermented food in laboratory condition, and to isolate different kind of lactic acid bacteria from this fermented food. So here actually I'll give a small video and see that how we prepare in this bamboo shoots in our laboratory. So we collected from the local market these bamboo shoots. We cut into a defoliated the bamboo shoots, and then we cut a small round pieces, then remove the core part, as you can see. Then we wash in tap waters, and we having this bamboo gum. So and also one glass jar. So we cut a small pieces all these bamboo shoots and put into there in the glass jar first, and then put into this bamboo gum also. So we make a two different preparation in the laboratory. One is, and then put in the top of it the banana leaves. We tight it. This is the same way as they prepare in the tribal people. And now we put into this 30 degrees centigrade for 15 days for the fermentation part. So now I like to show the first two we prepare in the laboratory. This bamboo shoot, one from glass jar, another one from bamboo gum, and the other three we got it from Gangtok, like Sikkim. So the three the preparation we got from like commercially available bamboos bamboo shoot fermented food, and three are made by three different bamboo species. Like the third one, BT, they prepare from Bambusa tulla. DH prepare from Dendrocalamus hamiltoni, and the DS prepare from Dendrocalamus sikimensis. So now I took two from the lab preparation and three from the commercial, and then we want to see what kind of lactobacillus is present in this 5 preparation. So that we have started the the preparation of the this bacterial isolation. So we make the small mesu homogenate into one small tube, then make a different dilution 10 to the minus 1 to 10 to the 9, and we put into the MRS agar plate. And after we getting these colonies, we collected them and stored into the glycerol stock. So this is one of the example, one of the preparation. We put different dilution. You can see that different colonies come. So one of the best dilution we choose so that we can get the very pure and isolated colonies. So now, as I said, that we having a 5 different preparation. So we try to collect as much as possible. Like we collected 20 colonies from this from this preparation. But last one, BT, we didn't get a lot of colonies. One of the reason we realized that sometimes in the bamboo shoot, when they fermented at the end, they put some preservative that kills the bacteria. The last one, which also commercial stores, we not able to isolate a lot of colonies. Very less was there, but we collected few from it. So total 66 colonies were isolated, and then we characterize them for their in vitro property, whether they having any probiotic properties. Like we started with morphological and also tolerance tests like shape, gram staining, acid tolerance, bile tolerance. Then we looked the cell surface property, hydrophobicity, autoaggregation, safety analysis, hemolytic activity, antibiotic susceptibility, physiological and biochemicals like motility, catalase, and adhesion property. And we also try to look the genotyping by doing 16S ribosomal sequencing. So we want to identify all 66 isolates that we collected from that from 5 different preparation of bamboo fermented food. So we isolate the DNA, and then we send to at THST Dr. Bhavtosh Das lab for their look that their sequencing by doing 60 years ribosomal sequencing. And after completion of the sequencing, we come up with each and every isolates come up with their bacteria. Most of the cases they are 98% similarity, and then some of the color we are showing here, which looks different, blue color or kind of greenish color, they are kind of new strain which was not reported before. In bamboo shoots there are some work has been done, but there are new also species was found which is not found in the literature. So these are the all 11, like if you look the all 66, so they are some very common, except one of them we have not taken it, which looks like a pathogenic, but we took 11. Out of 11, 9 are lactobacillus strain, and 2 of them are Pediococcus and Wisela. So now we started to look all those bacterial species, whether it is reported previously with any kind of documentation with the cardiometabolic disease. So then we come up with one of the bacteria, Lactobacillus brevis, which is shown a very good literature search showing a very good data. So here basically we come up with one table, like looking only the few property like gram staining, morphology, catalase, motility test, and hemolytic assays. And when we put the table, and then from the table we come up with the 25 strain further from 66, which also have the all probiotic property, as well as they survive in acid tolerance test and bile tolerance test. So out of these, as I said, that NGBT36. So this is the strain, we take it forward for further validating in vivo model. And as I said, this strain basically have L. brevis is there, and we found that in literatures that previously there are some studies has been done that particular bacterial strain have adipogenic effect. They also have cholesterol lowering effect, also shown to suppress high-fat diet induce increase in body and epidermal fat weight gains. They attenuated several abnormal associated with metabolic dysfunction, inhibit intestinal absorption of cholesterol. So overall, this particular species looks very promising to go to testing in the next in vivo level. So this is the summary of their particular strain. They are catalase negative, they are gram positive, non-motile, and auto aggregation is 17.44%, hydrophobicity 14.81. Also, they have antimicrobial activity that done with the 3 bacteria, E. coli, Salmonella typhi, S. aureus. Antibiotic sensitivity, they are sensitive most of the cases except streptomycin, which is shows resistance. We look the literature also previously shown Lactobacillus brevis is resistance to streptomyces, and that hemolytic activity shows that this bacteria
Dr.
does not.
Banerjee, you have 3 minutes.
Okay, sure. And also look the gram negative, gram positive bacteria. This is a study to show that they are adhesion with the CACO2 cells. Now coming to the in vivo data, where we have just initiated the study. We are middle of it, but some of the interesting data I thought I can going to show you. That the animal we use the C57BL6. Like total study was 14 weeks. The first 2 weeks we just keep them with a PBS, and which is a control group. Then disease model also we keep the last 12 weeks choline deficient hyper diet, which causing basically fatty liver, insulin resistance, and cardiovascular complication. And the third group, which is a therapeutic model, we have given first 2 weeks every day L. brevis, which is a 1×10⁸ CFU for 2 weeks, and then we continue with every third day Lactobacillus brevis. And after 14 weeks, we're supposed to sacrifice. We have completed till now 4 weeks, but we want to show you some of the data which may show some interest. And so in general, after 4 weeks, it's very difficult to look some data, but we did for the presentation that body weight gain was started from the CDHF group, which is a the cause maximum cardiometabolic disease, and there's a trend to decrease body weight after L. brevis. Similarly, IPGT test was done 120 minutes, which supposed to be, you know, high value of the glucose, which was again, it's a very early to say insulin resistance, but there are tendency that L. brevis group having a lower glucose level. Similarly, we did some echocardiography study. Our institute has one image system, Vevo 3100, which works basically through ultrasound as well as photoacoustic system, which is a laser-based image system. And we did liver, fatty liver, images, as well as we did some echocardiography study. I like to show the first in the fatty liver, we measured the fatty liver in by image system. We looked at the CDHF diet. There's an increase of fatty, fat accumulation in the liver by doing liver echogenetic testing. As you know, the L. brevis, there's a showing there's a decrease of the fatty liver. Similarly, we did echocardiography, and there are 3 different groups are there, and we did 2D echo to see that their contraction relaxation. And this is the summary of the study, that none of the parameters are showing any significant change, but like to tell you that systolic volume was decreased in L. brevis group, ejection fraction was slightly increased, fractional shortening was slightly increased. That's showing there's a tendency to increase that cardiac contraction. And I think with time we can know, generally CDHF model after 12 weeks there's a lot of decrease of the ejection fraction, fractional shortening. If this particular bacterial strain can increase the cardiac function, that will be benefit at the end stage. So this is a summary of a study that MESU is a fermented bamboo shoot we prepare in the laboratory. 66 bacterial colonies were isolated and characterized by different in vitro methods. 11 bacterial species were identified by 16S ribosomal sequencing. Lactobacillus brevis was chosen for a further in vivo study in a mice model of cardiometabolic syndrome. Oral administration of Lactobacillus brevis showed tendency to reduce body weight, blood glucose level. Similarly, the same bacterial species showed tendency to reduce fat accumulation in liver and increase cardiac function. Till now, the data obtained very early stage shows very promising, but we have to wait for another few more weeks to get the final data, and a lot of histopathology, cytokines, all the parameters will tell me the the final outcome of this work. So what we wanted to see that we have done the we have
Please come to the conclusion.
This is the last slide. This is the last slide, sir. So finally, we want to see that this probiotic, whatever isolated, make a formulation, and if we can try in human. So I am looking some partners who are doing human studies and clinical studies. They look my data and how to take it forward to the human studies. So this is the acknowledgement. I am thankful to Dr. Bhavadas Das from THSTI who have done the sequencing study, and also different time point whenever I get any kind of suggestions or discussion, he give a lot of good input into the project. And 3 of the students who are involved into this project, Rasmita Datta, who is a second year postgraduate student who has done most of the study as I've shown the data. Siram Mahajan also part of the study. He has started the in vivo animal model. And Nabia she is very good on image systems. Most of the image data was developed by Nabia. So thank you very much, for that, the opportunity. Now I'll be happy if you have any questions.
Thank you, Dr. Sanjay, for sharing the interesting information from the Northeast region. Thank you very much. We will come back to you with a limited set of questions very shortly after the end of this session. We will move on to the